is Rachel Mahinay, BSN 3, and today I will be performing the perineal care. Perineal care, it is the aseptic cleaning of the vulva and a perineum. So now let us prepare for the equipment that we're going to use for the procedure: the bedpan, the dry perineal balls, the perineal pad, the gloves, extra sterile forceps, the tissue paper, flushing pitcher with warm water, and the waste receptacles, and other materials that we're going to use for the procedures also. And explain the procedure to the client. Good morning, mom. My name is Mahinay Rachel, and today we'll be gonna performing the perineal care. And mom, what is your name? Okay, mom, Liamim, I know your name. Okay, thank you. And this procedure to keep the vulva and perineum clean, to promote the healing of perineal wound, to prevent infection, to prevent disagreeable odor, to provide comfort. Second, to make sure that the patient have a privacy, and remove any perineal pad if any, wrap it with paper and discard into the waste can. Before we proceed, let's consider this. First, the flushing water should be of the right temperature to avoid burning the patient. Second, observe special care with a patient has a perineal wound or stitches to avoid much discomfort. Third, if the patient defecated or voided, empty the bedpan first before giving perineal care. And last, discard used perineal balls into the waste receptacle, not into the bedpan. So before we start, don't forget to wash your hands to prevent the spread of microorganisms. First, loosen the fluid part of the top sheet and place patient in dorsal recumbent position. In dorsal recumbent position, this position allows the patient to lift herself into the bedpan. And let us assume that it is a rubber protector. So, place a rubber protector against patient's buttocks. The rubber protector protects bedding from getting wet. And place the patient on bedpan. Fold the top sheet towards the knees to expose vulva and perineum. Providing privacy avoids overexposure. And let us assume we're putting a bath towel over the abdomen area. Putting a bath towel over the abdomen area, it protects the gown from soilage. And next, let us pour the still water over the vulva. Rationally, rinse off urine, fecal, and vaginal drainage using warm water. Warm water helps in relaxation of nerve endings. And clean the vulva and perineum using perineal balls soaked in solution. Use a downward stroke in the following sequence. First, center of the vulva. And do it in the same manner in opposite position. Second, the farther labia minora. The same manner in opposite position near labia minora. And fourth, the farther labia majora. Do it in the same manner in opposite position, the near labia majora. Center of the vulva, mons veneris means pubis. Use a fresh perineal ball for each stroke. Repeat sequence of cleansing as necessary. Contamination from rectal area is prevented by using a downward stroke. Cleansing an area where there are few organisms before cleansing one with numerous organisms minimizes that spread of organisms to cleaner areas. Don't forget to discard all the used perineal balls and rinse area with warm water. See to it that the solution is completely rinsed off. Soap that is left on the skin and mucous membrane may cause irritation. The dry vulva and perineum with dry perineal balls following the same sequence in cleansing. This enhances patient's comfort. Wet or moist environment cultures bacterial growth. wipes it or dry it using the perineal balls in the same sequence. And next, may you remove now the bedpan and turn patient near you. This position makes it easy to dry buttocks and anus, working close to an object. Prevents overstretching, which may cause muscle strain. Dry buttocks and anus using tissue paper. Tissue paper as a mechanical means helps in cleaning the area. To make sure that the area is clean and dry, do it in the same sequence. Be sure to use fresh perineal ball for each stroke. Repeat cleansing if necessary. Assist the patient to assume a recumbent position. Apply medication as ordered in perineal pad if necessary. Prompt attention of details, patient's comfort and confidence. Done. And last but not the least, assess your patient in a comfortable position. And lastly, don't forget to wash your hands to avoid the spread of microorganisms. Thank you and God bless.